Happy evening, viewers. Welcome to yet another episode of our GarbhaSandesha, episode number 36. Today, the topic of choice for today's discussion is the impact of smoking and alcohol usages on infertility. And to talk about this, we have two esteemed doctors from our panel. Firstly, Dr. Vandana Ramanathan. Dr. Vandana is a fertility specialist who holds a fellowship in reproductive medicine degree and then a super specialty degree. And then Dr. Vandana is known for the comfort and confidence she elicits in her patients, and she believes in performing fertility treatments with a scientific approach and in an ethical manner. She also offers to counsel for infertility treatment with dedication towards her patients. She practices in our Kalyan Nagar and Marathali branch. Next, we have Dr. Jahnavi Esanakula. Dr. Jahnavi is a diligent and dedicated fertility expert practicing at GarbhaSandesha IVF Center in our Electronic City branch. Dr. Jahnavi also holds a fellowship in reproductive medicine and has co-authored several papers published in international journals. She is known for her very approachable nature and immense dedication to our profession. Firstly, I welcome you both doctors for today's episode of GarbhaSandesha. And immediately, I would want Dr. Vandana to respond on today's topic. What would be your initial take on the topic, madam? Impact of smoking and alcohol usages on infertility.
So, good evening, everybody. So today's topic is impact of alcohol and smoking on fertility and pregnancy. So this is a very important topic because of late we see a lot of people who are addicted to recreational drugs, who do a lot of social drinking, social smoking, and it starts at a very young age. So even youngsters are getting into this habit, and once you get into this habit, you tend to continue it even for the rest of your life. They are quite unaware of what effects it has on their body. So not only from fertility point of view, each and every organ of our body can be affected, especially with long-term exposure to these kind of drugs and smoking and alcohol. So it's very important that we discuss. Of course, our discussion is more pertaining to fertility and pregnancy, but this is a topic that is very less known to most of the people because smoking causes cancer, drinking causes a lot of health problems is known to everybody. But especially when it comes to fertility, that it can affect our fertility as well, is really not known to many people. So I feel it's quite important that we discuss this today so that our young generation, the youngsters and the people who are planning pregnancy now will benefit out of it.
Thank you, madam. Thank you for that talk, bringing relevance to today's topic. My first question would be to Dr. Jahnavi Esanakula. Madam, what is the role of alcohol in male and female infertility?
Good afternoon, good evening, everybody. So on the onset, I would like to add to what Dr. Vandana said, that smoking and alcoholism definitely are on the rise today. Especially because young generation, they will think because of peer pressure or because their friends are doing it, they also want to look cool, or so they'll start doing it. So what happens is, by the time they realize the side effects of those, the damage will have been already done. Okay. So when you come to alcohol specifically as to how it impacts fertility, it can have impact on both the male and female partners. Okay, in the male partner, alcohol, especially daily drinking or binge drinking or heavy drinking, that has, and chronic drinking for a long duration of time. That means for a long duration of time, daily drinking has been shown to affect the sperm parameters. That is, sperm shape of the sperm can be a little bit abnormal in these individuals. The sperm movement also can be a little bit abnormal. And what is more important apart from this is there is alteration because of the liver effects. There is alteration in the hormonal metabolism also. That is, the way in which the hormones are processed is also altered in these individuals. It is both in females and males. So male and female hormones tend to alter. Usually with heavy drinking, they will tend to go down in both males and females. That can have an impact on fertility. And with regard to specifically females, it has shown to impact the release of the egg, that is called ovulation. It has shown to impact the release of the egg, and also especially if they are drinking in early pregnancy, or they do not know that they are pregnant and do have drinks, that can have an impact on the unformed baby as well, that is fetus as well. So these effects can be seen in alcoholism.
Thank you, madam. Dr. Vandana, can alcohol affect fertility, sexual performance, and sexual health?
Yes, definitely alcohol can affect fertility. It affects. So what happens is, first and foremost, when people have a tendency to drink, usually after they drink, their senses, their cognitive functions come down. So one is that the sexual desire comes down, and for men especially, they have problems with sexual performance, like they might have problems with erection and ejaculation. So these issues will lead to decreased sexual performance after drinking. So alcohol can affect the sexual function of for the couple, and eventually when they're not able to have a proper sexual intercourse, then pregnancy becomes a problem. Secondly, this is only pertaining to the sexual performance. Per se, alcohol can have an effect on the reproductive function in females as well as males, where their sperm parameters, semen parameters come down. So the quality of the sperm, the sperm count, as well as the motility comes down. And in females also, it is shown that chronic drinking, chronic alcohol consumption can cause issues with the egg quality. So definitely consumption of alcohol can lead to decreased sexual performance as well as problems in future fertility as well.
Thank you, madam. Dr. Jahnavi, would you like to add something to this?
No, I think Dr. Vandana has covered it pretty well. Definitely because of the alteration in the sexual hormones of both males and females, there can be decrease in sexual desire, especially in males because of low testosterone levels. That's what happens with chronic drinking. When you drink over a long period of time, there can be low sexual hormones in your body, which can lead to less sex drive.
Thank you, madam. Next question is coming to you, Dr. Jahnavi.
Yes.
What is the impact on one's biological clock because of alcohol?
See, biological clock, when you're talking about, usually it pertains to the females. That's what we usually talk about. But when you take alcoholism, like I previously said, there is an effect on the ovulation. That is, release of the egg is definitely affected with alcoholism, and it leads to many other problems. Though eggs are there, egg count may not decrease, but there is problem definitely with the egg quality. And when the egg is not being released, there is no chance that it meets the sperm. So the essential part of egg meeting the sperm, that doesn't happen. That leads to fertilization failure in these females. And also, when you come to other effects, there is a chance of having more ectopic pregnancies because of delayed ovulation, and also having the muscles of these tubes and ovaries do not work properly, the muscular cells which are there because of chronic drinking. So this can all have impact on fertility. Biological clock, yes, egg count may not decrease, but egg release is definitely affected, and also egg quality is definitely affected.
Thank you, madam. My next question is to Dr. Vandana. Madam, what are the effects of smoking during pregnancy?
Okay, so there are multiple studies that have done the effects, studies on effects of smoking during pregnancy. So it is well known that smoking per se decreases the blood circulation. So when this happens in pregnancy, there are more chances of having a baby which is small for gestational age. So the baby will have baby's growth is not adequate. So it will be a low birth weight baby. Baby's weight will be less. It will be a small baby. And many a times the placental perfusion. So placenta is from where the blood goes to the baby. So placental perfusion is known to be affected in smokers. So there won't be adequate blood flow to the baby. So when this happens, again, there can be this leads to growth problems in the baby. There can be preterm delivery. hypertension in pregnancy because of poor blood circulation, and something called as placenta previa also is known to happen more in smokers. Placenta previa is again a condition where the placenta can be attached, is completely stuck to the musculature of the uterus. So this kind of placenta, one is they will not give good blood supply to the baby. Second is during delivery, they will not get separated properly and they can lead to torrential bleeding in the mother, which is a very life-threatening situation. So smoking in pregnancy can have a lot of harmful effects for the baby as well as the mother. So this is something that has to be stopped. If a person is smoking and they find out that they're pregnant, the sooner they stop smoking, the better it is for the outcome.
Thank you, madam. Dr. Jahnavi, what are the birth defect risks while smoking during pregnancy?
See, smoking, first of all, smoking, when you talk to infertility specialists, you understand it affects all organs, and definitely infertility is on rise with smoking. When the woman somehow manages to get pregnant also, there is more chance of miscarriages in smoking. And I think pregnancy complications, Dr. Vandana has spoken regarding specifically fetal effects. You are looking at anomalous fetus in terms of cleft lip, cleft palate, and also there is a risk of sudden infant deaths. So that is called they will not have any specific cause for death after in infancy, that is in the first year of life. There can be sudden unexplained infant deaths in babies who are born to smoking mothers. So these are all affected, shown defects in smoking mothers.
Thank you, madam. Dr. Vandana, does smoking cause cervical cancer?
Yes, cervical cancer, one of the risk factors for cervical cancer is smoking in women. Whether it is active smoking or even passive smoking for that matter, can cause increased risk of cervical cancer in women.
Okay, thank you, madam. Dr. Jahnavi, can smoking and alcohol make one infertile?
Yes, when you talk about smoking, it has variable effects like alcohol also it alters the way our hormones are metabolized in our body in both males and females, and semen parameters are very drastically altered in smokers, especially chronic smokers. When you smoke for more than 5 to 7 years, you can see on a daily basis, you can see that sperm abnormalities are there in terms of shape, count, motility, everything, and also DNA of the sperm can be damaged. And once these damages are done, it takes a long time to reverse all these effects. And also in females, both smoking and alcoholism is known to reduce fertility, though the mechanisms are different. Smoking tends to alter the oocyte quality, it tends to decrease the egg count. But in alcoholism, the oocyte release is not going to happen. It alters the motility of the tubes, and it also alters the endometrial receptivity. Smoking and in receptivity, in the sense when the baby is formed, it has to come and attach to our uterus for the pregnancy to continue. For that, the uterus should also be ready to receive the baby. So this crosstalk between the endometrium and the uterus is highly altered in smokers and alcoholic women. So definitely, on the whole together, smoking and alcoholism can have an impact, serious impact on fertility.
Thank you, madam. Most of these questions and the answers to these questions look similar, intertwined, but still, these are the questions of the viewers. So even if the questions seem repetitive, please bear with us. And then I request you both to answer. I would request all our viewers, like, in this month, we are having across all our centers, first free infertility consultation, free at all our centers. I would request all our viewers to avail this till the end of November. Now, my next question would be to Dr. Vandana. Like again, will smoking have an effect on my eggs or sperm? Though might seem repetitive, it will be a well-rehearsed answers for our viewers also, madam. So
yes.
Please go ahead.
So smoking will definitely affect egg as well as sperm. So what has been found is that when chronic smokers, pertaining to women, chronic smokers have a tendency to have decreased ovarian reserve. So their egg count can start decreasing sooner. So they might have a diminished ovarian reserve, and in these kind of patients, they also tend to attain menopause earlier if they are chronic smokers. This is only relating to egg count. Like Dr. Jahnavi already said, smoking also affects the tubal motility. It affects the lining. So the endometrial lining, the uterus lining will not be healthy. So when the lining is not healthy, even if there's an embryo that is formed, it cannot get attached to the uterus lining. Since the question is only about egg, that is why I was more focusing on the egg, where the count decreases and the egg quality also comes down in chronic smokers. Coming to the sperms. Now, chronic smokers, when it comes to males, they will have decreased sex hormone production, like decreased gonadotropin production. So when the gonadotropin production decreases, so the sperm production from the testis decreases, and eventually in chronic smokers, they can have testicular atrophy as well. So when this happens, the blood circulation to testes decreases, the sperm production from the testes decreases, and whatever sperms are produced in the testes will not be of good quality. So what we call sperm count, that comes down. Secondly, the motility. So the sperm has to have good motility to actually swim inside through the uterus into the fallopian tubes to go and meet the egg and fertilize it. That motility is hampered in chronic smokers because the sperm motility will be less. And thirdly, the sperm morphology. So the shape of the sperm. Now the sperm has three parts: head, neck, and tail. So each and every part, there will be head defects, neck defects, tail defects. These are called as abnormal sperms. So these men tend to have more percentage of abnormal sperms and very less percentage of normal sperms. And the normal sperms are the ones that have more chance of giving a healthy pregnancy. So over a period of time, they will have issues with their entire semen parameters: sperm count, motility, as well as morphology. So the fertility in these patients will definitely come down.
Thank you, madam, for that comprehensive answer. Now, Dr. Jahnavi, I do not smoke, but my partner does. Could this second-hand or passive smoking affect my fertility?
So this phenomenon of passive smoking is definitely there, and it is seen more in Indian population, especially when the husband smokes and the wife does not. Definitely, inhalation of passive smoking has been shown to have some side effects. It is as severe as an active smoking, I can tell. Especially if the woman is pregnant, even passive smoking has shown similar effects to active smoking especially on the fetus. That is all the abnormalities which can happen to smoking mothers. It can happen if the baby has a smoking father also, and especially if the smoking father does smoke in the same room and they share and does smoke in the house. Definitely the impact is more. And it has an impact on young children as well, especially if you have infants. The impact on the children, like they will have asthma and they will have growth stunting, the lung problems will increase. All these impacts will be there with passive smoking also.
Thank you, madam. Dr. Vandana, the continuation of this answer is another question. If I stop smoking, will chances of my conceiving and having a healthy pregnancy improve?
Yes, definitely. When one stops smoking, there are better chances to have a pregnancy and to continue a healthy pregnancy. Now, the period of time for which the person has stopped smoking before getting pregnant is going to have a better impact. So the longer the time that he or she has stopped smoking is going to give more time for the body to repair itself. And eventually, if they get pregnant after a long period of abstinence from smoking and drinking, they have better chances at getting pregnant as well as better chances at having a healthy pregnancy. So the sooner, if you're planning a pregnancy, both partners have to be equally involved. It's not like the lady is going to get pregnant, so I will stop smoking and drinking, you continue doing what you want. That doesn't happen that way, because baby is formed with egg and sperm. So both partners have equal role to play in that. So if they're planning a pregnancy, both partners have to start abstaining from smoking as well as drinking, so that they have a healthy embryo. And a healthy embryo is going to give a healthy baby. So it's not just about, the lady stopping everything and having a healthy pregnancy. That is not how it works. it has to be from both sides. And the sooner, the better.
Thank you, madam. Dr. Jahnavi, how does smoking during pregnancy affect my baby's fetal development?
See, smoking, when you talk about smoke particles, like they're able to percolate into the lungs, they have effects on liver, they will have the similar kind of effects on the unborn baby as well. Some particles of the smoke definitely can cause placenta. First of all, the placental circulation is hampered, which causes some of the fetal abnormalities. Rest of them, the smoking particles which are percolating or that which cross the placenta also will have some fetal effects. So because of the placental effect, you can see small babies being born to term women, babies without proper lung maturity, babies who are born prematurely. All these are some side effects. The other caused directly on fetus because of percolation of these products of smoking into the baby are cleft palate and anomalies, especially on lung tissues and brains. These can be seen in smokers.
Thank you, madam. Dr. Vandana, the chemicals in cigarette damage eggs and sperm and can affect a baby's health. Is it true?
Yes, absolutely. So I think all through our discussion, we have actually listed quite a few points how the chemicals in cigarette smoke can affect the egg and sperm. So I'm sure the readers, the listeners have got the answer by now. But just to reinforce it, definitely the chemicals in cigarette smoke can cause issues with your egg and sperm quality and also egg and sperm numbers. Okay, and what is seen is that this carbon monoxide that is released when you're smoking, that carbon monoxide has a tendency to cause genetic abnormalities in your egg and sperm as well. So eventually, if you have a pregnancy with these damaged eggs and sperms, the embryo formation is not good. So it will be an unhealthy baby embryo that is formed, which can lead to either abnormal babies or can lead to early miscarriages, because nature has its way of rejecting abnormal embryos. So when the embryo gets attached to the lining, within the first 3 months, they will suffer a miscarriage because nature will reject abnormal embryos many a times. So this is how it affects the pregnancy.
Thank you, madam. We have one last question. Like Dr. Jahnavi, does smoking cause miscarriage?
Yes, smoking does cause miscarriage. It can happen either because of embryo problems, like just now Dr. Vandana said, the embryo quality can be poor, and nature has a way of eliminating all those bad quality embryos. So smoking causes increase in risk of miscarriage because of embryos, and also even if it causes problems at implantation level as well. So when the embryo is ready to implant, by chance you have got a good embryo also, the endometrium will not be ready to receive it. So that is called receptivity. There is endometrial receptivity problems also, along with increased risk of miscarriage.
Thank you, madam. Now that's all we have questions for today's time. I would like both of you to conclude on today's topic. I would request Dr. Vandana to conclude from her side.
Okay, so like we have mentioned several times through this talk, smoking and drinking have very harmful effects on our body, especially pertaining to when it comes to fertility as well as embryo quality and throughout your pregnancy. So it's not like after the first 3 months you can resume it because baby is already formed, organs have formed. No, it takes complete 9 months for the baby to be formed, and throughout those 9 months, it's best that you don't expose yourself to alcohol as well as cigarette smoke, be it active smoking or passive smoking, because it's going to have an effect on your baby. Those who are not yet pregnant or who are planning pregnancy should abstain as a couple from active as well as passive smoking and from drinking as well, because again, like we have mentioned in all throughout the talk, it's going to have harmful effects on our sexual activity, egg quality, sperm quality, uterus lining. So each and every step is going to be a major obstacle for you when you are planning pregnancy if you don't stop this beforehand. Also, I would like to touch upon one thing that we have not discussed, that is fetal alcohol syndrome. So when women are drinking through pregnancy, it can affect the forming baby, the fetus. It's something called as fetal alcohol syndrome. Now, this fetal alcohol syndrome causes craniofacial abnormalities, in the baby, as well as it causes neurodevelopmental abnormalities. So baby will be born with some defects as well as decreased neurodevelopmental abnormalities. So the brain development is affected, the nerve development is affected, and this can eventually have you can give birth to a baby who is not mentally competent enough. So this is something that is very, very important that everybody should know about. So try to abstain from drinking as well as early as possible if you're planning pregnancy.
Thank you, madam. Dr. Jahnavi, conclusion from your side?
Yeah, as a reproductive medicine specialist, we have seen quite a few patients who have had male partner smoking and female partner smoking also. In IVF, when we take the oocyte and put it under a microscope, from a smoker to non-smoker, even though they have same age, same egg count, everything, the oocyte, that means the egg quality difference is drastic. The same way it is also for the sperm quality. The sperm quality difference is drastic. So it is better to abstain, like Dr. Vandana said, as soon as you're planning pregnancy, but always prevention is better than cure. So if you don't start, that is even more better. If you don't start smoking or alcohol, that is even more better. But if you are planning for a pregnancy, a minimum at least, because whatever oocytes or eggs we are seeing today or whatever sperms we are seeing today, they don't have genetic material of today. They have genetic material from past 2 to 3 months. Okay, so if you're planning to abstain, at least 3 to 4 months, that is the bare minimum of abstinence that is required to show some positive effects. That is, if you quit smoking today, that effect can be seen after 2 to 3 months. That effect will start to show. I'm not telling that is the best time, but at least it takes that much time for the effect to start. So that much damage you are causing to a gametes in terms of damage. And definitely, if somebody is planning for pregnancy and they are smoking, I would advise to stop for them to stop as soon as possible from a fertility expert, from a fertility point of view.
Thank you, both doctors. Viewers, the message from both our specialists is very clear. Planning for a baby, 3-4 months earlier to that, keep away from smoking and alcohol. Thank you. That's it. We have the